Perfect. Thank you everybody for coming out. Pretty good turnout already, and hopefully some more show up as well. Thanks to Dr. Lanpher for donating her time and knowledge to us. We're super stoked to hear from you. I just wanted to start with a quick intro. This is Dr. Lanpher. She completed her undergraduate education with a Bachelor of Arts in Public Health with honors at Brown University. She then continued her medical education at Alabama College of Osteopathic Medicine and is most recently a PGY-4 resident at the University of Utah, having also completed her chief resident year earlier this spring. Outside of medicine, she enjoys to be involved in athletics, things like CrossFit. She's a previous Boston Marathon team runner and also played on the Brown University varsity lacrosse team. She also enjoys traveling to find the best local coffee shops and finding small venue concerts. So, without further ado, if you have any questions, you can toss them in the chat and I'll turn the time over to Dr. Len.
Sweet, awesome. Thanks. Thanks for having me. I'm Arianna. Like he said, a PGY-4 at the U. Originally from Florida, spent most of my time on the East Coast, but then moved out here to the Mountain West. Um, Kind of want this to be pretty informal. I have some slides for everyone, but if you have any questions or anything, we'll do questions at the end, but feel free to kind of like unmute yourself and just pop in the questions. I'm sure if you're thinking it, someone else is. So I, if you have any questions, please ask because I kind of kept it a little bit broad with some room to kind of go into more detail here. So without further ado, so audition rotations, I feel like for a lot of DO applicants, pretty important in the sense that a lot of us don't have home institutions with rehab programs. So even without like having it be like a program that you're super interested in, it's a great way to get exposure to the field and to get some letters of recommendation if that's something that you're looking for. Let's see here. This will work. All right. So, kind of something to consider if you're a third year or a fourth year who is either like has audition rotations scheduled or like still in the process of trying to get some. I would kind of how I approached it, which is like this is just my point of view. Obviously, you can take everything with a grain of salt and kind of incorporate things that you like resonate with you, but I would consider what goals you have. Like, are you a person that has like a strong preference for like geographic location? Because if that's the case, you should probably apply to like that area rather than kind of like broadly across the country. If you're interested in like size of program, rehab programs tend to range from like 2 residents all the way up to 12. Our program, we have 7 per class. This is all per class. Like we're 7 per class, so we're kind of in the middle of size. I think that's something you should really consider in the fact like if you only have like one other co-resident, you could like not really jive with that person, which is totally fine, but just kind of something to consider. B, less people means more call. You'd have to like really consider the call system. And so that's one thing. And then if you have a specific interest, I do think it's really great to kind of go into like any sort of residency, like open-minded, but we're also all adults and you have like sort of a vision of what you want your future to be. So if you're like, I'm going to be a spine bro, then maybe don't go to a program that is like super heavy inpatient just because that would potentially not be something that you would like really need, probably make you just a better doctor. But think of like if you want to do pediatrics, make sure they have like a good pediatric exposure, things like that. You can typically figure out like the rotations in the curriculum. It's listed on the residency website under like curriculum and like it outlines a lot of like what your rotations would look like as a resident. And then I think also important to consider is categorical, which means you do all 4 years, including your intern year at the same institution, or advanced, where you do a transitional year or preliminary year at another institution, and then you transition into like your advanced PGY 2 to 4 year in rehab. Um, I am the type of person who likes to kind of like be in one spot, get to know everyone, get to know the system. I didn't want to move multiple times, so I prioritized categorical programs over any advanced programs, regardless of relocation, because that was just really important to me. So something to consider as you're like applying or going through your audition rotations. I would say during your audition rotations, jot down things that you've liked um, during the rotation, or things like oh, like this was awful. Like one thing I noticed when I was on audition rotations, I did 3 of them, and one program had didactics every morning from 7 to 8 a.m. And I was in New York City, and I thought it was pretty terrible because you'd have to like go to that hour didactic to then go to whatever location you were going for clinic. It just felt like pretty hectic every day versus some programs have like 4 hour chunks once a week or 2 hour chunks twice a week. Something to kind of like little nuanced things like that that you wouldn't really know to even consider if you hadn't experienced it during your audition rotation. So just I felt it was helpful to kind of like make a little bit of notes of like, oh yeah, this is really important to me. Like this is going to be in my list of like must haves. Um, that's another thing to kind of consider is making a list of like, I absolutely want these aspects in a program. Another column being like, this would be really beneficial if it had it. And then other things were like, could take it or leave it. And then other like, if this has it, I don't want to be a part of that program kind of thing. Um, and I would write more stuff down than you think because I assumed I was going to remember everything after my interviews. And then I looked back at my notes and I was like, what was I even jotting down? Like, so err on the side of like maybe take more notes than you think you would need because after you do a bunch of interviews, they all kind of blend together. Um, okay. I don't know. I heard we have like some mix of like third and fourth year med students. So kind of like how and when to apply. I mostly used VLSO. It has like the dates of when every program's open. I feel like when I was applying, it was like February, March that opened, and then you like got invitations like April through May kind of thing. Um, but AAPMR has a really great like medical student website that kind of outlines like what you should be doing ideally as like a first, second, third, fourth year medical student. So I highly recommend going to this website and kind of just checking out the resources that they have because there's tons of information um, that you could kind of use as well when you're applying. Um, I would say apply more broadly in numbers wise than you think. Like if you're trying to get like 3 auditions, like I would apply to like 12 to 14 programs just because it's kind of luck of the draw on what programs you're going to get to. Like just because you apply to a program doesn't mean, and you don't get an away rotation doesn't mean that you're not going to get an interview. Like so many factors go into when you're doing these away rotations. A, do they have space that's not getting used by their home institution? B, there's no longer scores now for like level 1. So it's like they don't even have that to go off of. You have your transcripts and then some like really basic letters of rec and probably like a pretty poorly written personal statement. Um, so like I wouldn't don't lose sleep if you like didn't get your dream audition. Like that doesn't mean you're not going to get an interview or potentially match at that program. I didn't do it. A lot of us in my class didn't do auditions at Utah, and we all matched there. So just apply to programs that A seem like they have a good like structured medical student away rotation. I think that is really helpful if it feels like you're getting a wide variety of different inpatient, outpatient, pediatrics, EMG, sports. I would look for something that has more of like a wide breadth of exposure versus like you're doing the same thing the whole time. Just because A, that gives you kind of a look into what the program as a whole looks like versus like just seeing sports where like a program could really excel at sports but then kind of lacks in like some other areas that you wouldn't necessarily notice if you didn't rotate through. And then you get to see like you get to meet more residents, meet more faculty, kind of see what life as a resident would look more like rather than just like one specific thing. Um, but yeah, I would say VLSO. There's probably some other websites as well. I wouldn't recommend reaching out to programs if you don't hear from them. It never hurts, but it's it's all like kind of just systematic, and unfortunately, I think a bunch of kind of luck if your schedule matches up with an opening at the program. Um, I think as a medical student, I thought more went into it than I think potentially does. They definitely read everything that you're sending in. They read all of your everything, but I do think it just depends. I know at the U we have now rehab is a mandatory rotation, so we have significantly less opportunity for outside medical students rotating just because we have less free time that's not being occupied by the Utah students. So things like that also come into play. So I know it's all very stressful, but I don't stress too much. I do recommend doing audition rotations. I think they're incredibly valuable, but don't stress if you're like, oh, I didn't get like the ones that I really hoped I would get. So kind of like how to prepare for audition rotations. This is your time to shine. Um, and it's your time to like kind of see if this program is what you're looking for. Um, I think all of my audition rotations gave me insight into I definitely want this in a program. I don't want this in a program. So I felt like even if I was like, I'm 100% not probably going to come here, it was still a really good experience. And you can pull experiences that you have from these rotations to talk about certain things in interviews just to get a better understanding of what like rehab medicine is, because that will be important when you're interviewing. They're going to want to see that you have like a good understanding of like neuro rehab, outpatient. Definitely the more inpatient experience you can get the better, just because it's kind of the bread and butter of rehab, and kind of a little bit more nuanced than like your basic outpatient clinics. Um, so it's nice if you can really touch upon kind of the foundation of rehab through like a more inpatient lens. So things to know as a medical student. Um, I would say you should 100% know the basic manual muscle testings and the innervations of each muscle and what nerve root like corresponds with them, what nerve innervates them, like pretty cold. Like if anyone asks you a question about it, you should be able to do it. If you don't, I don't really know how people like residents don't grade medical students, at least at the U. I don't know what attendings think of it, but I definitely know when people know more, we remember. If you don't know something, people aren't like, oh my gosh, that was awful. But if you can know those basics, and then if you knowing the neuro exam, the cranial nerves, the function, you'll just like stand out more because rehab is a very nice field, so people don't anticipate people knowing anything. Um, but when you do know it, then everyone's like, wow, this person's like really put some time and effort into knowing these like pretty core things to rehab. So practice that, just kind of know it like the back of your hand. AAPMR has a really great Asia exam video. So for any spinal cord injury patients, kind of having an idea how the exam is done. If you just type in Asia exam on Google, there's like the form that comes up that we fill out. They go over like manual muscle testing, like how to position the limbs. I think in medical school you get really good at grading like 4 and 5 and 3, but people struggle with like 0 through 2. So just kind of doing that. Or if you're a medical student and you have a resident with you and there's some downtime, if you're like, hey, like I feel really comfortable with grading muscles that are like anti-gravity or above, can we kind of review like muscles that maybe aren't as strong? I think that looks better than just like that to someone is like, oh, this person is being thoughtful. Like they've tried to do this, but they just need a little bit extra help. and people would be like more than happy to kind of go through that with you. Um, PMR Pocketpedia is really wonderful. Oops. That's kind of like a great thing. It like fits in your pocket. Um, you could read it like if there's any downtime in like an outpatient clinic or something where you like don't necessarily have access to a computer. Would highly recommend getting that as a medical student. I don't really think you'll use it much as a resident, but I used it a bunch as a med student. PMR Knowledge Now is probably one of my favorite resources. You can type, it's pretty much like up to date for rehab, not as good, but for rehab, it's really wonderful. It's very specific to our field. Um, and it's a great thing if you want to, like, say you're going to be on the stroke service, you could just read about stroke management, things like that. And then I mentioned before, this AAPMR portal is like phenomenal. I used I used it, watched a ton of the videos as a medical student and thought they were like super high yield. Not that I think people are gonna be like quizzing you on all of this, but it just really helped like further understanding um of the pathophys that we see a lot in rehab. And kind of like I said, read up on any basics. Um, it's great not to go in like totally blind if you're like going to be on a TBI service, stroke service, sports, spine. There's literally, you can read up on anything, and it definitely goes a long way. We can tell if people have like some idea of what's going on, and then you can just ask more thoughtful questions when you're on rounds and things like that, if you rather than just not having any like background knowledge. um I do think as a medical student on an away rotation, I feel like that's your time to kind of like be academic and take advantage of being there, from an academic standpoint, as well as like seeing if you jive with the faculty and residents and things like that. So, kind of how you can stand out. I think it's incredibly hard sometimes to stand out as a medical student because everyone is wonderful. And so you have to kind of like do some more like subtle things, I think, to kind of for people to be like, oh, okay, like we would love to have this person as a co-resident. So first thing is like be on time. I don't know what has happened recently. I feel like in the past couple of years, like no one's on time anymore, which is really weird like as a medical student. It's one thing if you get lost or something that happens, but I don't know. We've had a lot of med students that are just never on time. And people notice. They're not going to say anything, but they notice. So my rule of thumb is like try to be 10 minutes early or just right on time. So just don't be late. I don't know if it's going to affect anything, but I definitely think it's kind of weird when people always show up late. Um, and then oh, there's a typo here. We're co-residents, like residents are looking for like other co-residents that are like hardworking team players, willing to help out, not people that are like just trying to cut out as soon as someone tells you to leave. Um, Also dress code, people like randomly ask about this. It's totally kosher to ask what the dress code is. You can save yourself feeling a little awkward if you show up in business casual and everyone's in scrubs. Um, I would say if you don't want to ask, outpatient, typically business casual. Inpatient, you can normally assume scrub, but if you're not going to ask, I would assume business casual and then kind of suss it out from there and figure out what's appropriate or not, because every institution will be like slightly different. Um, Highly recommend pre-rounding on your patients. It's rare for any rehab residents to pre-round on patients. Intern year, you'll be pre-rounding on all your patients before, but I think as a medical student, definitely pre-round. That gives you the time to go chat with the patients, form more of a relationship with them, and then have a better idea for like what you might want to do based on like for your assessment and plan portion of your presentation. I just think it's a really good habit, and it shows like it shows really good initiative, and that you're there to like kind of there for your patients when you pre-round. And you can ask the residents like, hey, like, do you think it's okay if I pre-run on my patients? No one's gonna say like, no, don't do that. rather than just like chart checking. And then a big thing is residents are very busy during the day. We love hanging out with med students, but it's like sometimes you're with like a new PGY-2 resident who's also trying to figure out what the heck's going on. So it's nice when medical students can just like kind of take initiative and like want to like make the most of their time. Me personally, there's nothing worse to me than if I have to tell a med student what to do all day. Like I have a lot of things to think about and I don't want to be like, we're all adults. Like you're here to learn. You're here to like be your best. There's nothing better than someone that's like, oh, I'm gonna go check in on my patient on the gym. Like it's totally fine to like let us know that you're like going to do something, obviously, in case we have something planned out for like the afternoon or what we're gonna do as a team. But no, like everyone will notice if you're like, hey, I'm gonna go see so and so in the gym. If you are gonna see patients in the gym, just make sure you check in with the therapist that's taking care of them to make sure that they're cool with you coming to watch. um you can ask the patient to like, hey, do you mind if I come check out what you're doing in the therapy gym this afternoon, kind of things like that. Just be respectful of the other providers as well. I would say checking in with them in the afternoon if you're not doing something is really great. It's a great opportunity for you to kind of get to know the family, get to know the patient. It's really helpful to the resident if you kind of are the point person to whatever patients you're taking care of. Like, oh, like someone's member needs to be updated, volunteer to do that. If, oh, like so and so like had foot pain, but we couldn't really address it on rounds, go back and find out more information, come up with some sort of assessment of what you think's going on and like what you want to do. Really take ownership of whatever couple patients that you are taking care of and like read up on what type of, if they have a stroke, what kind of stroke do they have? Why do they have it? What is the typical like plan for like anticoagulation, things like that. Those like small things that you might not think people will notice, like will notice if you're like on rounds, like having very thoughtful assessment and plans. Like people will 100% notice that because a lot of people don't do that. So like when you do it, you're like, wow, that was really great. Some people like some institutions will have you write notes. You'll have access to the EMR. Some don't. If you're like a rotating person, um, that doesn't mean you couldn't offer like, hey, like, do you want me to write these notes on this patient? History and physical. I think history, like doing an admission, is an incredibly good way to learn, and it will take you a couple hours probably to do it. So it's a great way to kind of like keep like busy like the whole like a good portion of the day. Even if you aren't allowed to write the note, I would practice writing like a basic note, like look at someone's that's already admitted's history and physical and kind of template it after whatever they were, however the institution likes to do it. um it's small things like that. Like a resident can go through the note with you, but then you can also like go through an old H&P and kind of reread it and be like, oh, okay, like these are the important things. This is what they pulled out. This is how they like to, like, this is their basic assessment and plan template. Just little things like that. And you could like kind of jot stuff out. And then I would offer to be like, hey, can I present this to the attending? This is your time to like really give your best effort. No one's expecting you to do a perfect like presentation. Just do your best and try to make it like succinct to rehab. Um, so like definitely talk about social history, like functional history, things like that. I would say if you feel like you're not great at oral presentations on rounds, practice before you go, or the night before, write down like a one liner, like practice a little bit. Oops, sorry guys. Um, if you feel like you get a little bit nervous, I mean, we all been there, we get it. So like there's no need to be like nervous. But if you feel like maybe you haven't had as much practice doing that, yeah, practice it, concise, a few minutes, nothing super long. Basically we like to hear, at least at the U, like don't whatever you do, don't model after how residents give oral presentations on rounds. At the U, we're very informal, but attendings want to hear a medical student like do a more formal presentation. It's kind of like not fair, but kind of how it goes. So like one liner so the whole team can kind of know why this person's here, like very short, like whatever their age is and what rehab diagnosis they're admitting for. And then it's nice to say like whatever that you like they've been work like whatever deficits they have. Like if they were like a left MCA with right um like paresis, like dysphagia, aphasia, things like that. And then for the subjective, if you chatted with the patient, a great time to just like say very briefly what you guys talked about, nothing extensive. And then I just jotted down here some like objective findings that we typically like to go over. So you could say like Bob Smith, 57-year-old male, admitted with a right MCA. No overnight, like no overnight events, vital signs are stable. No need to list out like every vital if they're stable. And then you could say like report sleeping well overnight. If there's a sleep log available, you could go into that. Slept 8 hours, didn't have any interruptions. Denies any pain this morning. Bowel, he's continent of bowel. Last bowel movement was this morning. In mixed continents of bladder, bladder scan volumes of blah blah blah. And then any pertinent PR and medication. So if you have like an agitated TBI patient, oh, they got 2 extra doses of Seroquel last night around 1 a.m. and 3 a.m. Kind of clues you into like what they're doing, things that you could potentially like look at, like, oh, do we need to schedule like sleep medications, things like that. Kinds of gives you an idea of things that you could potentially talk about in your assessment and plan. And then go into like if you did a physical exam, pertinent findings only. We don't need to hear like heart sounds or irregular, things like that. And then assessment and plan is where I'd focus the bulk of your like these things, and then assessment and plan. Try to have a thoughtful, it doesn't have to be anything earth shattering. Keep it short, keep it sweet. For like think like from a rehab perspective. I think I have that on the next slide. Yeah. So consider like rehab things. So like if someone has a stroke and they're having shoulder pain, okay, after stroke, sometimes you can like everything is weak. So like your shoulder, the humerus gets pulled down and it has like subluxation. Not something we would think no like think a medical student would be aware of, but like if you're thinking like that, like oh, like what are some things that can happen after stroke, you read up on it and you're like oh, like this guy's having shoulder pain, we could consider getting an x-ray to see if there's any subluxation. They could consider taping. We could try lidocaine patches. Yeah, you under get the picture of like a more thoughtful like rehab specific approach just to like stand out of like oh, this person's thinking like a physiatrist. Obviously if they have a kidney injury we need to address that, but that's internal medicine. You'll all learn that when you're an intern. And then any of these things, sleep, nutrition, pain, wounds, agitation, MSK, spasticity, those are all like rehab specific. So like if you hit on nothing else other than like thought about these things, you would 100% stand out on your audition. Because people would be like, oh wow, this person's thinking about these very specific things. Like basically anything how we can get people participating more in therapies, helping their recovery is kind of what we're after. So those are all great things to kind of like cue in on instead of like getting sometimes, especially where I work, like people are very sick. You can kind of bog down with like the medical non-rehab issues, which is what fine when you're a resident, but when you're a med student, like really just try to take advantage of like this opportunity to like think like a physiatrist and you can kind of lean more on the resident in attending to like kind of deal with the more medical issues, if that makes sense. They'll probably ask you still like, oh, this person has an AKI, like what do you want to, is it like what do you want to do about it, kind of thing. Another thing is if you have have a problem based assessment and have a thought on just any plan, it doesn't have to be the right one. Just think of something if you're going to bring it up. And then, kind of like I mentioned earlier, make the most of your time at wherever you're at. I always say, like, kind of like romanticize it. Like, this could be your future if it's a place that you're really interested in. Um, Volunteer if there's like adaptive sports, like, kind of get involved in like the opportunities that you have that relate to rehab in the area. I think adaptive sports is a really fun one. And most areas have some sort of adaptive sport, that opportunity that you could do. And it doesn't have to be like with residents, like you could just go do it on your own. People could kind of help you like get plugged in, but and then chat with residents, kind of get to know, see if you kind of vibe with like the personalities of who's there. Check out the city. I always like to like check out restaurants, breweries, things like that. I enjoyed asking faculty why they, if they trained there, why'd they stay? If they didn't, why did they come there? How do they like living in the city? Things like that. Um, Consider transportation when you're looking at audition rotations. Like if you're not gonna have a car, are you gonna live, like stay by something that makes it easy for you to like either take public transit or are you gonna bring a bike? Like it's just like not feasible if you're like always getting Uber. Like I just like make sure you're thinking about like what's gonna make you as like a person like happy of like are you always going to be stressed about the transportation like to and from the hospital, like oh where are you going to park, like little things like that when you're not familiar with the area, like just add to the stress level and like add commuting time on to your day. um and then when you're at like work, like obviously like limit the time that you're on your phone, like bring other sources of, like you could be reading on your phone for all people know, but like most people aren't going to think that. So like bring either like the Pocketpedia. If you bring I would say bring a laptop because sometimes computer space is very limited. So if you have like remote access to the EMR and stuff, you can still get on. And then that way you could like read up on up to date, like EMR knowledge now, things like that, where it's like a more like socially accepted, like to be on your laptop rather than your phone. Um, I always say read the room. Um, if someone says like, "Hey, you can head out," and you're like, "Oh, well, it's noon." Like it could be that there's nothing else to do. It could be a lot of different things. If you want to leave, great. I would recommend against that. But if someone tells you like 3 times that you can leave, you should probably go. Um, but I think there's a lot of ways that you can spend your time, if even if you feel like there's not like there's no admissions, there's not like you've checked in on your patients, like you could go like to the gym, you could go like see like, oh, is there like any other like opportunities for you to kind of like fill your time. um so I always say like just try to make the most of your time and just be your own advocate of like if you want to go check in on your patient again for the third time, go for it. Like that's kind of the beauty of being a medical student is you get to like really spend way more time with whichever patients that you're following. And kind of what I've reiterated, research topics that are relevant to your patient. If you're really feeling ambitious, you could be like, oh, like you could bring up whatever you found on rounds and kind of do having a little teaching moment for everyone, which is always so wonderful. Um, and then I know there's always the question of letter of recommendations. I would say you want the letter of recommendation to be whoever knows you the best as a person and like has seen you in like a great light, like knows your personality, things like that. It's pretty obvious when you get like a very generic letter of recommendation. Um, So I would say I would go over like I would go for someone that knows you over like just a random program director. If you're doing away rotations, I would ask whichever attending you felt like you worked with the most and felt like you knew them. You could ask your program director if they could write you one, but if you didn't work with them, like it's going to be very generic just based off of a like CV, which is basically uploaded to ERS anyways. So I would go for a more personal one. Definitely try to have rehab letters of rec. And then if you're going to try to do away rotations where you need to get away like letters of rec, I would say at the latest end of August to ask for letters. You could do early September, but I don't know the timing of everything. I think it's end of like October is when everything opens for interviews and stuff. So I wouldn't wait much longer than that. So if you're planning to do a ways to get letters of rec, try to plan them like July and August, September time frame. But if you don't need them, then you could do them a little bit later. And then I asked some of my co-residents for advice to give you guys as well, just to kind of round it out, not just from me. Most of this advice is from like interns, so they were more recently in a similar position as you guys. Um, One of the residents said, always introduce yourself. Um, Helps kind of reduce the feelings of like the foreignness of this like unknown new hospital system. She also recommended the PMR Pocketpedia. And then, similar to some things I've already said, try to connect with patients. It will help you with deepen your understanding of rehab and then also help you down the line with like residency interview questions where you can like pull from some like real examples. Um, and then another resident said, gauge the vibes of the attendings and residents. Would you like to work with them? Do you like their teaching style? Like, did your days like kind of drag on, or did you like leave work being like, oh my God, that was so awesome? Like, had a great day. Um, really felt accomplished kind of thing. And then another resident said, try to get familiar with the EMR environment early in the rotation. Um, I think, yeah, kind of just like playing around with the EMR is, I think, the best way to do it. Obviously, if you need something specific and you can't figure it out, you should definitely ask. But I think just kind of like if you've never used it before, just kind of like play around and see what happens and kind of go from there. Um, One person said, don't badmouth patients, own up to your mistakes. And then another person said, try to be a great learner and implement feedback versus trying to know everything 100%. I think this is fantastic advice. Just, if you don't know an answer, like, hey, I'll look into that, I'll get back to you, is a perfect answer rather than trying to just like think you like seem like you know everything. Also like reduces like stress. And I agree with him. Always have a tentative idea of what you would do initially for any sort of question or plan. Um, and kind of have thoughtful questions as you go along. Okay, any questions? There's a lot of information that I just gave you.
That was perfect. I think I shared most of the pre-submitted questions with you, and you hit those pretty well. There were a couple that came in later that I'll kind of put you on the spot really quick, and then
Yeah.
if anybody else has any questions, either toss them in the chat or feel free to unmute yourself as well. The first one that was kind of interesting was, what has a student done that has left a lasting impression on you and made you think, I want them to be here?
Yeah, that's a great question. Um, I would say one student that worked with me when I was a PGY-2 on my first rehab rotation, he actually matched here. He's an intern or PGY-2 currently. Um, he was just like was ready to get into the trenches with me. He was like, "How can I be helpful?" He like really like showed that he could like take a good history, take a good fit, like do a good physical, and kind of like was pretty independent. Like I was like, okay, like why don't you go see this patient? He like really took ownership and wanted to be there, stayed late, and it was kind of like it was great because he was like really helpful in like in addition of like you didn't have to like tell him like, oh, can you do this? Like he was like, oh, I checked in with this patient, like this was the update, I called the family, like things like that. I feel like if you like show initiative and like show that you're like competently able to like do these things and don't need to be like told like, oh, please do this, oh, can you do this, like, and just like was like, oh, by the way, I was gonna do this if that's okay. Like it was like the best thing. And he was a really awesome person as well. I enjoyed hanging out with him. But it was like that initiative without being told that you should go do this is like a really, really good quality.
Love that. Any other questions from anybody else? Another one that popped up was while scheduling like interviews, because obviously PM&R has gotten more competitive, and so now people are trying to do more away rotations, and that kind of drives you further into interview season. If you're scheduling interviews during an audition rotation, would you go about like that? I guess that conversation, just letting people know that you need to, you need time away or whatever. How would you kind of approach that?
Yeah. I would say first off, if I don't know how they're doing it, but when I was doing it, some programs, it was like a first come, first serve like interview. I think they've gotten away from that. I think there's enough spots for everyone that they reach out to. But I would say if you need to like a schedule, like just go on to like Thalamus or however they're scheduling interviews during a rotation, it's completely fine. Like everyone knows like, oh, it's interview season, like things are happening. I would just like let your attending know in the morning of like, hey, like I might have to like step out of a like I might have to like intermittently be on my phone to like schedule interviews, like just so you're aware if it looks like I'm on my phone kind of thing. That's kind of what I approached it when I was like actually like physically scheduling them. And then if you're trying to ask for time off, I would just email whichever whoever you've been in contact with, like administrative wise, or if you know that doctor that you're going to be with, like, hey, on this date from this time, I have an interview. Most interviews are like a 3 to 4 hours. I would just say, like, and then I'll be in clinic afterwards. I would recommend against like taking a whole day off unless you truly have an interview the entire day. Even if you're in clinic for like a couple hours afterwards is better than kind of just like being absent for like a whole day, especially if it's a program that you're like really interested in.
Perfect. I think this has been pretty much all inclusive. I think you covered from A to Z pretty well. Here's a question from Eric. He said, if you have a PM&R rotation coming up and it's your first time being exposed to PM&R, what is some pre-work you can do now to be prepared for that coming rotation? And then what helped you kind of feel most prepared for your aways?
Yeah, so if you've never been exposed to rehab before, I would say going on to like the AAPMR's website and like kind of looking at the roadmap and then going on and like looking at some of those videos would be really helpful. And then I would just say like knowing the manual muscle exam and the neuro exam, physical exam wise, will really set you up for success um, with those alone. And then kind of just take each day as like a learning opportunity. I would say if you can have exposure during your third year before going into fourth year auditions, that's probably the best, but not every school gives you the opportunity to kind of do that. So,
All right. Any last burning questions out there?
yeah,
Yeah.
and if anyone has questions, I put my email on the screen. Um, you can feel free to email me. Happy to answer any other questions that come up.
Hi, I just have one quick question. So first, thank you for the lecture. It was super helpful. I'm actually on a rotation right now, so this is reinforcing everything I need to do. But I was just wondering, so is it the same with outpatient clinics? Would I want to, well, is it different, approaching inpatient rotations than outpatient, and what should I do to prepare differently for outpatient if there is a difference?
Yeah. Do you have like what kind of outpatient are you seeing?
It's gonna be at a VA hospital, so I've been told that there's gonna be more hands-on, hopefully like injections and
Okay.
other kind of procedures that I'll be able to be exposed. But I think that's the major difference in as far as I know. But
Okay. So it's like, is it like sports, MSK kind of thing? I'm kind of leaning. Did they tell you that or no?
um, I mean, I think it's more sports
Okay.
related. Yeah.
Yeah. I would say for outpatient, it can be a little bit harder, especially if you don't have access to like the before like what patients you're going to see. But if you genuinely know you're going to be doing sports, I would review like basic like shoulder pathology, so like rotator cuff injuries,
Mhm.
um, things like that, and then just like knee osteoarthritis, um, similar thing, like knowing like a good manual muscle testing, and then for shoulder exam, being like, oh, like these, like if I think they have this injury, like knowing like the special testing you could do for a shoulder exam. Or if you're with an attending, like, oh, I think they have a rotator cuff injury. These are the special tests that I remember. Like, are there any other additional tests that you would do, kind of thing?
Okay.
Um, and then if you have access when you get to the clinic of like you could see the patients, it's always great to like kind of read up on whatever their backstory is. But if you
Right.
don't, I would encourage you to take a good history. It's better as a medical student to be there in there a little bit longer rather than come out of the room really quickly and it feel like pretty abbreviated and things like that. So like kind of remembering like the OPP, whatever it is, it's like pain, when it started, how
Mhm.
long it lasted, what makes it better, what makes it worse, that like really like basic medical student, like
Right.
even on our oral boards, that's like what we have to do. So like keeping that in mind of like hitting all of those things um as well. And then also still remembering the social and functional history of like, and also always ask people if they've done physical therapy
Okay.
because that's
Gotcha.
always a treatment option.
Sounds good. Thank you so much.
Yeah,
Appreciate
no
it.
problem.
All right. There's nothing else. Thank you, Dr. Lanpher, for the sharing your time and experience with us. Your email's there on the screen, so jot that down if you haven't already. Thanks for joining everybody and have a good evening.
Yeah, best of luck, everyone. You guys are gonna crush it. Um, yeah, great field to get into. So you all made the best choice. Thanks.